It's not doing it. It is now. It's on now.
Okay. All right. Part two. Last time I did her posterior lung sounds. I have to do her anterior lung sounds too. So I'll do those quickly. Then we'll get into the heart sounds. Then I'll have her lay down and do listen to her bowel sounds. So lung sounds again. I would start up here above the clavicle to hear that. I think that those are vesicular sounds. And then I would do the same thing with a Z pattern. So if you could just take a couple breaths. Again. Good. Inhale. Again. 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 If you need to sit down, okay. Again. 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 Okay, her lung sounds were regular, strong, no adventitious sounds, a good rate and rhythm. So now I'm going to check her heart. So there's 5 different points to assess the heart. There's the aortic valve, the pulmonary valve, Erb's point, tricuspid valve, and the mitral valve. So the aortic valve would be on the right of the sternum at the second intercostal space. So the intercostal space, in case I didn't mention, is the spaces in between your ribs. So the first one is the first part between 2 ribs, and the second is the second in between the second and the third rib, and so on. So the aortic valve would be the second intercostal space to the right of the sternum. So I'll palpate the sternal notch, and I would ask, there it is. So I'd listen to the heart sounds of the aortic valve. Okay, then I would move over to the pulmonary valve, which is exactly to the left of the sternum at the second intercostal space. Then right below the pulmonary valve is Erb's point, the third intercostal space to the left, just to the left of the sternum. Then for the tricuspid valve would be the 5th intercostal space, just to the left of the sternum. And then finally it would be the mitral valve, which is the point of maximum impulse. That would be the mid-sternal region, right there. So I would take this apical pulse for 1 full minute, listening for the rhythm, murmurs, dysrhythmias, and especially the lub-dub sound. And she has a regular rhythm and rate, and it's strong, and it's in between 60 and 100 beats per minute. So now, when I would be assessing her blood pressure, once again, I'd put the blood cover on her arm right above the brachial pulse, 1 inch above. The systolic phase would begin with the first heart sound, the S1, and the closure of the mitral and tricuspid valves, which would be the AV valves. Now the diastolic phase would begin with the second heart sound, the S2, the closure of the aortic and pulmonic semilunar valves. Okay, so now I'm going to listen to your lungs, your bowels. So if you just lie down here, I'll pull this chair out. If you could just sit down, we'll recline it. Okay, now this is best to listen to her bowel sounds. So I would inspect, auscultate, palpate for any masses, distensions, symmetry, and note if it's soft or firm. So I would start palpating in the right lower quadrant and move up to the right upper, and then over to the left upper, and then the left lower, like a sort of an upside down horseshoe. So I'd inspect, look at the bowel, look at the abdomen, auscultate, palpate, and everything feels soft. There's no distension, and their stomach is soft. So I listen to bowel sounds in all 4 quadrants, starting in the right lower. I'd be listening for the activity of the bowel sounds, hypoactive, hyperactive, and she is presenting with normal active sounds. So I'd go to the right lower, the right upper, it's good, and then the left upper, and then the left lower. And they're all present and normal active. So if there were no bowel sounds present, I would have to assess each quadrant for 5 minutes with my stethoscope, just to be sure that their bowel sounds are absent. So I palpated for any pain or tenderness and a reaction if she was having any gardening. So was there any pain or discomfort?
No.
Okay. No. I would assess for bladder distension, especially above the symphysis pubis. And I would ask her about her bowel movements. So are you having regular bowel movements? Anything abnormal than the usual?
No.
Okay. And your diet is good?
Fine.
Fine fiber diet, eating plenty of fruits and vegetables. And
absolutely.
everything within your limits. Okay. Okay, so now that she's down here, I would assess all of her additional pulses since I'm here. I would start at the temporal, which would be up here. Palpate just one at a time because you don't want to block any blood flow to the head because it could pass out. The temporal, the carotid artery, and then the brachial will be here. We already assessed that. The radial will be down here, as well as the ulnar, which would be on the opposite side of the wrist. The femoral pulse would be down here, right by the lower quadrants. And the popliteal would be behind the knee. And now I would assess her pedal pulses. This is her dorsal pedis pulse, and it's positive. It's good, strong. And now her posterior tibial, which would be right below the her ankle. That's good. And there's no edema, no swelling, no bruising, mashes, lesions, scars, anything abnormal. So can you lift up your leg a little? That's good. No pain, no nothing?
No.
Okay. I'd take her sock off. Can you wiggle your toes for me? Just wiggle your toes. That's good. Can you push down? No, push up. Good. So your ankle, no swelling, no, it doesn't hurt, no nothing?
No.
Okay. Now I would also take time to talk about her diet. So she stated earlier she weighs 130 pounds and is approximately 5'4" in height. So that's been verbally identified. Have you been having any nausea or vomiting lately?
No.
No. So that's absent. And any difficulty swallowing, regular diet, no soft?
No.
Okay, good.
No.
Okay, now I would, she was a relatively new admission to the hospital. I would ask about her female issues, such as last menstrual period, use of contraceptives, ability to perform breast exams and getting frequent mammograms, and if she's been sexually active, and if she's practicing safe sex practices, which you all stated before that she is, so everything is okay. Then upon throughout this entire assessment, her psychological behavior was appropriate to the situation. She seems to have adequate coping and support systems within the family and within place. She is religious. Spirituality is a part of her lifestyle. She's been completely compliant with care, and she demonstrated appropriate assessments for developmental level of a patient such as her. So as she walked in, I observed that her mobility, she had no limitations. Her strength was bilaterally on her upper and lower extremities. I assessed her spine upon looking at her, upon listening to her posterior lung sounds. And I assessed her joints, her range of motion, and she was absent of muscular dystrophy, had no weakness or contractures. And I also assessed her spine, which had normal curvature, and she demonstrated coordination and balance upon entering the room. So that would conclude our assessment. Thank you.